Hello everyone, my name is Dr. Felix from Atlas Spine and Wellness Care. Welcome. In today's video, we are going to learn how to stretch 4 muscles that are common triggers for migraines, but also get really tight during migraines and can be released, and when released can just relieve a lot of pain. Okay, those 4 muscles are the trapezius muscle, the scalenes muscles, the levator, scapulae, and the sub-occipital muscles. Okay, so we'll start with the trapezius. This muscle, the top part of it, runs from the base of the skull all the way to the side of the neck and the top of the shoulder. Okay, so to stretch it, it's really simple. All you're going to do is you'll let your head fall forward as far as it can go without forcing it down. Just let it fall like your head is falling to the ground. And then once it can't go any further, you're going to take either hand to start with. In this case, let's use the left hand. And you're going to apply a very gentle pressure downwards and towards the side of the hand, so to the left side. Then you should feel a stretch from the base of your skull all the way down the side of your neck, top of your shoulder. And if you don't feel a stretch, then just play around with the angle. Maybe the head needs to be a little higher, maybe a little more to the side, maybe a little more turn. Just play around and find where you can feel the stretch. And if you just play around and you don't feel it, then just get out of the stretch. This muscle just does not need to be stretched. Okay? You're going to hold that for a minimum of 30 seconds. 3 to 5 minutes is ideal. Once you're done with that side, just let the head fall back to the center. Just give it a few seconds. Then take your right hand, same thing, behind the head. Pull down a little bit. Bring it to the side a little bit. Then find the stretching point. And then just slowly ease into the stretch. There's no rush. 30 seconds minimum. 3 to 5 minutes is ideal. Okay, so that's number 1. Number 2 are the scalenes muscles. So those muscles run from the side of the head all the way down to the side of the neck, we could say. Okay, so the top part of the shoulder here and clavicle and the shoulder blade. Okay, so they attach around that area. So what you want to do is very simple. You're just going to let your head fall to one side without bringing the shoulder up. Okay, you just let the head fall, and then gently, again, you're going to take your opposite hand. So if my head goes to the right, actually I'm going to take my right hand, same side hand, and then I'm gently going to pull downwards. What you can also do, if you don't feel anything, you can act as if you're trying to reach the floor with the left hand in that case. Sometimes it creates a bit more of a stretch. Once you feel the stretching point, just stay with it. 30 seconds, 3 to 5 minutes is ideal. This stretch can be intense, so go really easy with the pressure with the hand on top of the head. Also, make sure you're not going forward. You really want your head to be, or your neck to be neutral. Then once you're done with that side, just go to the other side. Again, make sure you're not forward or even backwards. This is not very likely, but still make sure your neck is neutral, your head is neutral, and then you just bend to the side. And then you can reach down a little bit with the right hand, pull a little bit with the left hand. 30 seconds minimum, 3 to 5 minutes is ideal. Then the third muscle is the levator scapulae. This one is a little more tricky to stretch because of its attachments. So this muscle is here around the top region of the neck and attaches on the top part of your shoulder blade. So to stretch that one, you will need to find yourself a door frame. Okay, so you're going to lean back on the door frame, and then you want the edge of the door frame line kind of like with the edge of your shoulder blade or of your shoulder. And then you're going to start on whichever side you want. And you're going to bring your hand back and down, and you're going to grasp that door frame, the portion behind you of the door frame. Then try to walk your fingers as far down as you can. Keep your elbow lined up with your shoulder. It's going to have a tendency to go outwards. Keep it lined up, and then once you've done that, just gently lean the head forward, and kind of like what we did for the trapezius, you're going to bring your head forward and to the side a little bit. This one is really intense. You're not going to need to go very further. You're going to feel it very quickly. Once you reach the point of stretch, just keep with it. Again, 30 seconds minimum, 3 to 5 minutes is ideal. This one is really intense. So if you can't do it 3 to 5 minutes, no worries. It's totally fine. Once you're done with that side, just go to the other side of the door frame, or just turn around, and then you're going to do the other side. So walk your fingers down, elbow in line with the shoulder, let the head fall forward, a little bit to the side, opposite side, and then you just find the stretching point and stay with it. Make sure you're not tensing any other parts of your body. You really want to focus on relaxing the muscles so they don't get too tight on you or spasm. Once you're done with that side. And then lastly are the sub-occipital muscles. Okay, there are 4 of them. They're little muscles that attach at the base of the skull and top 2 vertebrae of the neck. One of the easiest way to stretch those muscles is to just bring your fingers together, and then you're going to put your hands, clasp fingers at the back of your head, and then just find the outer portions of your skull, that bone behind your ears. That's about where you want to start your thumbs, and then bring them midline inward until you reach a portion that is a lot smoother. That's where the muscles are. That's where they attach. So you want to be a bit on the smooth and a bit on the hard. So you want to be at their attachment point on the skull, and then once you find it, you're just going to relax the head and apply a gentle pressure. Again, you want to do 30 seconds, 3 to 5 minutes is ideal. And then you can lean the head back a little bit to relax the neck. But what's even better is to do that stretch just laying on your back in your bed or something like that. That's a lot easier. Then once you're done with a tense point, just move your fingers a little more medial, a little more inward. You might find another tense point. Then put some pressure on those 10 points again, okay? Because there are multiple muscles, they have a little bit different orientation and attachment points. They're not all in the same area, right? So you want to make sure you move your thumbs around, find all the tender points. Then when all of those are released, you're all done. All right, so that was it for this video. The 4 muscles: trapezius, scalenes, levator, scapulae, and sub-occipital muscles. Thank you for watching. I really hope this helps release tension and help decrease the triggers to your migraines and just give you a bit of relief. Take care.